Traditional practitioners call Tulsi or holy basil the queen of herbs, and they believe that it can help the body deal with stress. Tulsi or holy basil is an important herb in Ayurvedic medicine. It's especially known as an adaptogen, a herb that supports the body's stress response, whether that's physical, chemical, metabolic, or psychological. It's known as the Queen of Herbs, and in Sanskrit it means the incomparable one. In Hinduism, it's linked to the figure of the goddess. Tulsi is believed to promote long life, and it's taken as an elixir to promote balance and resilience to all of life's challenges. Traditional indications for the herb include common colds, bronchitis, diarrhea, stomach disorders, headaches, inflammation, arthritis, heart disease, skin disease, eye disease, various forms of poisoning, insect bites, and malaria. Tulsi is from the mint family, and it can alternatively be called Occium teniflorium, which is its Latin name. Different parts of the herb have been used medicinally, including the leaves, the stem, the flower, the root, the seeds, and even the whole plant. It can be taken as a herbal tea, a dried powder, or the fresh leaf can be used in cooking traditional dishes. There's many active compounds found in holy basil. Eugenol is largely responsible for the therapeutic effects of the herb. There's also oleanic acid, ursolic acid, rosmarinic acid, carvacrol, and many others. In a randomized, double-blind, placebo-controlled study of 158 patients aged 18 to 65, a whole plant extract of Tulsi was found to be 1.6 times, or 39%, more effective in the management of stress symptoms than a placebo over a 6-week period. In a study of 35 subjects with generalized anxiety disorder, taking 500 milligrams of Tulsi with 2 meals daily reduced anxiety and feelings of depression over a 2-month period. Tulsi prevented stress-induced changes in blood levels of corticosterone in rats. This is comparable to cortisol levels in humans. Tulsi's constituents show anti-stress activity, including normalizing blood sugar levels and cortisol levels at doses of 40 milligrams per kg in rats. An alcoholic extract of Tulsi root, 400 milligrams per kg, is a central nervous system stimulant or an anti-stress agent in mice. It was as effective as prescription antidepressants. In a small study of type 2 diabetic patients, Tulsi lowered fasting blood sugar levels by 17% and post-meal blood sugar by 7%. A water-based extract of Tulsi decreased blood sugar levels in a study on diabetic rats also. Daily ingestion of 300 milligrams of Tulsi leaf extract significantly increased IFNY and interleukin-4 and T helper cells and natural killer cell activity. All of these are important components of the immune system. This was after 4 weeks of intervention in 24 healthy volunteers. And Tulsi appears to increase both the Th1 and Th2 immune responses. A Tulsi extract significantly reduced the healing time after a jaw fracture in 29 patients. Tulsi may increase calcium uptake, bone calcification, or enzymes involved in bone remodeling, such as alkaline phosphatase. Tulsi essential oil had strong anti-inflammatory effects in an animal model. COX-2 is a molecule commonly targeted by anti-inflammatory medications. Tulsi is a natural COX-2 inhibitor. A study on Tulsi extract showed significant anti-inflammatory activity in human cells, validating its traditional use in treating cardiovascular disease. The anti-inflammatory activity of the compounds found in Tulsi was comparable to ibuprofen and aspirin. In rats, Tulsi promotes memory and attention by inhibiting acetylcholinesterase, thus increasing acetylcholine levels. Tulsi inhibited MMP9 in a cell study, suggesting that it might help to restore the integrity of the blood-brain barrier. A water extract of dried Tulsi protected against drug and aging-induced memory problems in mice, indicating that Tulsi may be beneficial in the treatment of cognitive disorders like Alzheimer's disease and dementia. Tulsi extract may prevent convulsions via its effect on the central nervous system, according to animal studies. An alcohol extract of Tulsi leaves reduced heart tissue inflammation in a mouse model of heart attack. This was possibly due to its high phenol content. Tulsi extract may prevent cardiovascular disease by inhibiting myelinoperoxidase, which is an oxidative enzyme that may cause plaque accumulation in the arteries. A study on Tulsi extract showed significant anti-inflammatory activity in human cells, validating its traditional use in treating cardiovascular disease. Tulsi leaf essential oil was shown to lower cholesterol and protect the heart via its antioxidant effect in rats. In a study on rabbits, Tulsi leaf also significantly decreased blood levels of cholesterol. Because Tulsi is rich in potassium, according to a trace element study, some researchers are studying whether it can reduce blood pressure. In a cell study, the Tulsi extract fraction eugenol and Tulsi oil inhibit ACE, which is an enzyme that increases blood pressure, in a concentration-dependent manner, and therefore may help to reduce blood pressure. An alcoholic extract of Tulsi leaf at 200 mg per kg body weight per day was shown to protect the liver from toxin-induced damage in rats. The addition of milk thistle at 50 mg per kg to Tulsi at 100 mg per kg was shown to have a synergistic effect in liver protection. An alcohol extract of Tulsi leaf with a eugenol content of 5% at a dose of 50 to 200 mg per kg twice daily for 5 days orally was dose-dependently protective against some types of stomach ulcers, alcohol-induced but not aspirin-induced. In a study of rats and guinea pigs, Tulsi protected against a variety of ulcer inducers, including aspirin, alcohol, and histamine. Strong antioxidant capacity was measured from Tulsi essential oil and was particularly correlated with its eugenol content. Tulsi leaf powder was shown to combat cadmium-produced free radicals and restore liver and kidney function in a study on broiler chickens. An extract of Tulsi increased the levels of antioxidant enzymes such as superoxide dismutase and catalase in rats. Tulsi's high antioxidant capacity was useful against oxidative stress in chicken and rats. Animal studies in mice show that an alcohol leaf extract of Tulsi reduced signs of pain, indicating its potential use as an analgesic. Another rat study showed that for both an alcohol extract of Tulsi and a water suspension of Tulsi at 500 mg per kg, it was effective as 300 mg of a non-steroidal anti-inflammatory drug, sodium salicylate. 2 flavonoids in Tulsi have been shown to protect human blood cells from radiation-induced DNA damage. Tulsi's essential oil has shown strong antibacterial activity against antibiotic-resistant Staphylococcus enterococcus and Pseudomonas bacteria species. A fatty oil of Tulsi also showed strong antibacterial activity against Staphylococcus aureus, Bacillus pumilus, and Pseudomonas aeruginosa, and had the greatest effect against the Staphylococcus aureus. Apigenin is a compound derived from Tulsi and has been shown to be effective against H1N1 and swine flu. An alcohol or solvent-based extract of Tulsi inhibited genital herpes in a cell-based study, and an aqueous extract of Tulsi leaves prevented the cell damage and the growth of Newcastle disease virus in chickens. Tulsi inhibits the growth of Candida albicans in cell studies. This may be part due to its constituent eugenol, which on its own has been found to inhibit Candida. You could check out my other video on Candida for more information about this condition. Breaking down biofilms and disrupting curum sensing is important for eradicating bacterial infections. Eugenol, the compound in Tulsi, is a natural biofilm disruptor. Rosmarinic acid, another compound found in Tulsi, also disrupts biofilms, but only in higher concentrations. In a rat study, treatment with 2 grams per day of fresh Tulsi leaves significantly increased testosterone levels over a 30-day period. It's unclear what kind of effect Tulsi could have on human testosterone levels, as this has not yet been studied. Tulsi seed oil blocks histamine release from mast cells in rats. This effect has not yet been reproduced in humans. In rats, 5 and 10 milligrams per kg of Tulsi extract reduced the incidence of cataracts by 20 to 60% respectively, in part by raising levels of antioxidant enzymes. Tulsi was shown to possess significant anti-cataract activity in rat lenses, which may be due to its inhibition of aldose reductase, which is an enzyme that causes the cataracts in diabetes. Tulsi increases catalase, which is an enzyme that breaks down hydrogen peroxide, and therefore it may keep hair from greying. Tulsi is currently being studied for its potential usefulness against skin cancer, lung cancer, and breast cancer, and its potential preventative effects against liver cancer, stomach cancer, and oral cancers. In mice, an alcoholic extract of Tulsi leaves applied topically was protective against chemically induced skin cancer. Pre-treatment with an alcoholic extract of Tulsi leaves decreased the number of tumours induced by a range of skin carcinogens in a mouse model of skin cancer. In another study, a water alcohol extract of Tulsi reduced tumour size and it increased survival rates of mice with melanoma. Tulsi seed oil was also protective against the development of skin cancer and improved survival rates of mice with tumours. In a review study, a Tulsi alcohol extract induced cell death in human lung cancer cells and suppressed the growth of lung cancer cells in mice. In mice, Tulsi extract reduced MMP9 activity, thus reducing the formation of tumours when tumour cells were injected into the animals. Tulsi extract reduced the formation of tumours in mice injected with lung cancer cells. Phytochemicals contained in Tulsi, including carnosic acid and rosmarinic acid and luteolin, are able to inhibit the growth of lung cancer. Cell studies have shown that Tulsi leaf extract prevented the spread of breast cancer and it prevented an increase in the level of COX-2 and an increase in inflammation. In cell-based studies, eugenol, luteolin, and apigenin killed human breast cancer cells. Carnosic acid and rosmarinic acid were also shown to inhibit the growth of human breast cancer cells. Tulsi protected the liver cells from DNA damage and increased antioxidant levels in response to cancer-causing chemicals and drug exposure. In rats, Tulsi significantly prevented chemical-induced liver cancers. Ursolic acid, which is found in Tulsi, prevented toxin-induced liver cancer in rats by decreasing oxidative stress. Additionally, anti-cancer effects were also observed in liver cells from the Tulsi phytochemicals apigenin, luteolin, carnosic acid, and rosmarinic acid. Studies have also shown that myrtenol, a monoterpene present in Tulsi, was effective in preventing toxin-induced liver cancer in rats. Studies have shown that including Tulsi leaves in the diet prevented chemically induced stomach cancer in mice. An alcohol-based 70% Tulsi leaf extract reduced chemically induced stomach cancer in rats. In an animal study, Tulsi selectively induced cell death in chemically induced stomach cancer, but not in normal stomach tissue. Eugenol was effective against chemically induced stomach tumours in mice. In a study of 41 patients in India, Tulsi combined with turmeric was shown to be highly potent against oral submucous fibrosis. which, if not treated, can progress to oral cancer. In hamsters, water extract of Tulsi taken by mouth had the greatest anti-cancer activity against papillomas and squamous cell carcinoma. In a cell study, Tulsi water extract was shown to be highly effective against oral cancer cells. Studies using rats have not shown any toxicity at the highest dose of 1000 milligrams per kg per day, using an alcohol or water extract for over 28 days. However, toxicity has been reported for Tulsi essential oil, which is about 70% eugenol, at a dose of 42 milliliters per kg body weight. The safety of Tulsi during pregnancy and breastfeeding has not yet been studied, so taking Tulsi during these times is best avoided until more is known. Tulsi might not be good for those with thyroid disease. An animal study found that Tulsi, at a dose of half a gram per kg body weight for 15 days, significantly decreased the serum T4 concentration. However, no marked changes were observed in serum T3 levels. Taking Tulsi with Valium may increase its effect on the immune system. Co-administration of diazepam, which is a benzodiazepine, with Tulsi seed oil enhance the effects of Tulsi on the immune system. People typically take 500 milligrams of Tulsi leaf extract twice per day for neurological and adaptogenic effects. Some people just drink 1 or 2 cups of Tulsi tea per day also.